Welcome to Put Health on Your Agenda. This is a Mojave County Department of Public Health presentation. Today's topic is COPD 101. This is a collaborative effort between Breathe Easy Arizona, the Mojave County Department of Public Health, and Ashline. I'm Carol Smith-Carter, a community health education specialist with the Mojave County Tobacco Use Prevention Program. What is COPD? It's chronic obstructive pulmonary disease, a lung disease that progresses over time, restricts airflow, and makes it difficult to breathe. COPD may include chronic bronchitis, emphysema, or both. Chronic bronchitis is a cough with mucus production that occurs every day for at least 3 months, 2 years in a row. This causes inflammation and scarring of the lining in our breathing airways known as bronchial tubes. When airways become inflamed, it causes excessive mucus production that blocks airflow in our lungs. Emphysema is irreparably damaged air sacs, known as alveoli, in our lungs. These air sacs promote oxygen exchange between the air and the bloodstream. Bronchitis and emphysema. This simple illustration shows a small segment of airways bronchial tubes leading to air sacs, alveoli. These tiny air sacs in the lung are microscopic in size. The left illustrates normal, healthy tissue. If you look here on the illustration. The middle shows airways with bronchitis. You'll see the airways here, and they are being obstructed by mucus, and this is bronchitis. And the right illustrates air sacs damaged from emphysema. Here are stretched out, smooth air sacs damaged from emphysema. A major difference between chronic bronchitis and emphysema is location. Bronchitis occurs in the lungs' airways, and emphysema occurs in the lungs' air sacs. Airways and air sacs. Healthy airways and air sacs in our lungs are like elastic. They expand and contract to their normal form as air moves in and out of them. This supports normal lung structure and function. Unhealthy airways and air sacs damaged by COPD are not able to expand and contract to their normal form. Structural damage causes the airways and air sacs to stretch and collapse, blocking the flow of air and making it difficult to breathe. Airways may also swell and thicken from mucus secretions that obstruct airflow. If you look at the illustration on the right, look to the top right corner, and you will see healthy airways and air sacs. They're pink and they're healthy and strong. Below them on the right, you will see airways and air sacs with COPD. Notice that the airways have collapsed and the air sacs are stretched out and damaged. This again is COPD. Here's some COPD facts. In the United States, 120,000 plus people die every year from COPD. COPD is the third leading cause of death in the United States and Arizona. More women than men die annually from COPD. There is no cure. However, there is an effective treatment to manage and slow the progression. The earlier COPD is diagnosed and treated, the better the outcomes. Signs and symptoms of COPD. Excessive sputum or phlegm, persistent or chronic cough, smoker's cough, feeling out of breath, shortness of breath, especially during moderate exercise, difficult to take deep breaths, wheezing, and limiting your physical activities. Don't ignore COPD symptoms. People often ignore COPD symptoms. They blame the symptoms on aging or being out of shape. They may modify their activities to accommodate shortness of breath and other symptoms. Some avoid physical activities that they used to do more easily. Unfortunately, most people who ignore COPD symptoms don't seek medical attention until the disease has progressed to a moderate stage. COPD has no cure. Early detection and diagnosis is your best defense. COPD risk factors. Smoking. 80 to 90% of COPD is due to cigarette smoking. However, 1 out of every 6 people with COPD have never smoked. There's environmental exposure risk, such as secondhand smoke, outdoor air pollution, indoor air pollutions, occupational exposure to chemicals and dust, and finally a genetic factor known as alpha-1 antitrypsin AAT deficiency, which causes 2 to 3% of emphysema in the United States. For more information on this, please visit www.alpha1.org. Who should be tested for COPD? Smokers over age 40 with symptoms. Anyone of any age with chronic cough, excess mucus production, shortness of breath with mild exertion, and wheezing. Actually, smokers who have smoked for many, many years of any age should probably be checked for COPD. What is a COPD test? It's a simple spirometer test. It's quick and non-invasive. It can diagnose COPD and measure the severity. You can have it done at your primary healthcare provider. If you look at the illustration on the left, this man is having a spirometer test. Spirometry measures how fast and how much air you breathe out. What if you're diagnosed with COPD? Talk with your doctor about risk, such as smoking and other exposures. Tell your doctor about all your symptoms. Write down a list of questions. Bring a family member or a friend to the appointment, because sometimes when we're stressed, we just don't ask the right questions or remember the answers. Visit your doctor routinely, maintain your treatment plan, and get annual flu and pneumonia vaccinations. COPD treatment. Common COPD treatments may include prescribed medications such as bronchodilators, which relax muscles around the breathing airways, corticosteroids, which reduce airway inflammation, antibiotics that fight bacterial infections. Pulmonary rehabilitation may include exercise, disease management and counseling, physical activity training, and oxygen therapy. Make some lifestyle changes. If you smoke, quit. Avoid exposure to air pollutants, dust, and secondhand smoke. Maintain a healthy diet. Join a support group like Better Breathers Club. To find groups in your area, visit breatheasyaz.info or ask your local hospital. Learn breathing exercises and practice light routine physical exercise. Here are some helpful resources. If you are thinking about quitting tobacco or ready to quit, you can contact us at the Mojave County Tobacco Use and Chronic Disease Prevention Program. I'm Carol Smith Carter in Bullhead at extension 2036, Annie Meredith in Kingman at extension 4360, and Misty Haas in Lake Havasu at extension 3437. We are here to help you. We also do have a self-management chronic disease prevention program. Or you can contact Ashline at 1-800-5566-222 or visit ashline.org. If you have more questions about COPD or any lung disease, please contact your American Lung Association or visit breatheasyaz.info. Put health on your agenda. Thank you for joining us. Knowledge is power. Remember, health starts where we live, learn, work, and play. This video is the property of the Mojave County Department of Public Health. Thanks again for joining us and have a very healthy day.